Wednesday to you all, and thank you for joining us today as we take some time to talk about our Community Concerns Assessment Report. For those of you who may not know who I am, my name is Lorianne Garambe, and I oversee the community engagement efforts for RMAPI. And I kind of took the lead with the production and the with putting together this community engagement or this community concerns assessment survey itself, as well as supporting with the putting together of the report itself. Angela Rollins and Kamran Zaman played a key role in helping really bring this vision to life for us to kind of be here today and talk about this. So if you want to go to the next slide real quick, Angela. So our objectives for today are really for you all to be provided with the high-level key report findings and recommendations, and to begin exploring what it might look like to utilize community voice, aka the feedback we've received, to inform any upcoming plans and decisions. Just a quick caveat, we received so much feedback that it is almost impossible for us to try to share all the key findings with you all within this hour time frame. So we are just going to touch on some key high-level findings and continue to encourage you all to take some time to go through and read the report, as well as the supplementary data studio, and dive a little bit deeper into the findings themselves. So to help us kind of set the stage for today, I want to take us back to May, where the RMAPI Collective was asked to think about how COVID will impact RMAPI's work. We came to the understanding that the problem we are working to positively impact will become wider, deeper, and more complex, and as a result of this pandemic. So with that being said, we took we wanted to be proactive and do some work to really better understand what it is that community members were dealing with, what they needed, what they would like to see happening. And so we went forward and implemented and put out this survey, went through and analyzed the findings and put together this report. And so the final report of the survey findings really aim to inform the strategies and plans for the work of our RMAPI moving forward, 2021 specifically, to inform the decision-making of stakeholders like yourselves. And then really, additionally, to build the habit of prioritizing and utilizing community voice as key data in decision-making. So the survey consisted of 30 comprehensive questions and was informed by RMAPI's previous community engagement efforts, in which community members share their needs and concerns regarding the COVID-19 crisis from when it began in mid-March 2020 through the end of April 2020. So the survey was administered online and took about 10 minutes to complete. Respondents were also able to complete the survey in Spanish, thank you to the support of Libero and helping us be able to make that possible. We asked questions around COVID-19 itself, the crisis, how people were dealing with this. So questions about their feelings of physical and emotional safety, as well as challenges paying and accessing basic needs. Again, the aim here was really to prioritize community voice as key data and decision making. We asked for solutions for economic recovery. What would make the most sense to support them as they navigate their way through this current reality and look to the future? So we asked, what would you need to feel safe? What would you need to recover financially? Again, focusing on co-creating solutions as we move forward. So we heard from a total of 549 community members impacted by poverty between May and June of this year. Over 90% of those voices were female, 70% were African American, 9% were Hispanic or Latino, and 15% were white or Caucasian. Over 50% of them made less than $25,000 per year, and over 80% made less than $50,000 per year, which is important for us because of our target population of individuals who are impacted by poverty. Over 70% had at least one child in the house, and the top 3 zip codes represented were 14621, 14611, and 14609. So due to the quarantine orders, this survey was only administered online, and our outreach efforts were solely online as well too. So as a result, we do acknowledge that there were a number of voices and experiences missed, especially understanding the reality of the digital divide that we are facing. So the analysis of the survey findings focused mainly on RMAPI's target populations. So single female-headed households, where we looked at female respondents with children in households, and working poor. And so we looked at respondents' income levels, and employment status. So we do recognize that you all have various focus areas within your own organizations, and we wanted to provide you all with a way to interact with data in a way that made the most sense for your specific interest areas. So with that, we had Kamran Zaman, who really helped us out a lot in building out a data studio where you all can dive deeper into the data. And Angela's going to walk us through that a little bit more now.
Yep, let's see if I can navigate. Okay. Great. So, and Rebecca, I don't know if maybe you could drop this link in the chat for everybody, but you can access the full report on rockresponsrmapi.com/report. Here, this link here would be the full PDF report. And then we also have what we're going to show now, which is a very comprehensive dashboard that Kamran put together where folks can navigate through the entire report's structured questions, so those multiple choice and check all that apply questions by any demographic that makes the most sense to you. For us, we decided to put on the lens of looking at income levels through this report, and especially looking at folks making under $25,000 with children in the household and who self-identified as an essential worker. And that was the lens we put on, but we wanted to make it available for anyone to put on any lens. You know, maybe age is important to your organization, things like that. So this first portion of the data studio has almost like an executive summary of the report, including methodology, key findings, and key suggestions. So this could be a really easy way to get a quick snapshot of the report. And then you can dive deeper into the full breakdown of demographics of survey respondents. And then you can navigate through the different structured questions. So for this question, I know where to find credible information about the coronavirus. We can actually go through and look at exact zip codes of who, you know, maybe we were worried about this zip code, or maybe your organization focuses on this zip code, and you can see how folks were talking about the coronavirus. You can do multiple layers of filters. So you can look at that zip code and parents or children in the household. We don't know if they're a parent or a grandparent or a different relative. So you can look at it that way. We have different groupings of questions. So we have general coronavirus questions. So those are feelings of safety, seeing how often folks were staying home. Were you afraid that you were going to get the coronavirus? Then we have income and employment related questions. So are you struggling to pay your bills? Are you unemployed? Did you have changes to your wages or your schedule? Things like that. And then the last chunk of questions are around basic needs. So how are you able to access your basic needs? Are you going to food distribution sites? What do you need related to transportation? And what do you need related to housing? So feel free to look through this all on your own as well, and we'll touch on a few key findings today during this presentation.
Angela, can you speak to how the questions were selected?
Yeah.
Oh, go ahead.
I can speak to that. So as many of you know, when the pandemic first started, we kind of went out there and just started asking people, what do you need? What are your concerns right now? What would you like to see happening? And so we use a lot of the feedback that we gathered then to really curate what these questions themselves look like, as well as just kind of looking at the various other, COVID impact questions or surveys that are being implemented throughout the country, and kind of using that to also help inform some of these questions as well too. But predominantly we use the feedback that we already collected to be able to inform these questions themselves. And then to your question, Christine, really our hope is that we understand that this survey, this report is not the end all be all as far as how people in our community are being impacted. And we know that there has been a number of different surveys that have been conducted and are being conducted. And our hope really is to try to figure out how we can use all the different bits and pieces we've collected to tell the fuller, more comprehensive story. So that really is the hope moving forward. Okay, so with that being said, we want to kind of dive a little bit deeper into key findings and recommendations. Again, I really want to keep emphasizing there's so much data and feedback that we were able to gather. It's almost impossible to try to condense that into like a short 45 to an hour meeting. And so we are just going to focus on some key areas within the report itself, specifically around how folks talked about navigating finances, as well as people's concerns around meeting basic needs. So that's what we're going to get into right now. All right, so as we navigated through the 549 voices and experiences reflected throughout the report itself, there was a common and constant theme of respondents highlighting the ways in which they were experiencing some level of being not fine, okay, fine, or thinking about what being future fine could look like for them. So these sentiments really brought to the forefront the overarching truth that people impacted by poverty or experiencing poverty on almost a continuum, right? So there's nothing binary about their current experiences. The deep dive analysis led to the development of the self-sufficiency continuum, which was really created mostly in part through our consultation and the support that we received from Dr. Joyce Duckles, who is our member of the RMAPI Data and Evaluation Working Group, and the consultants at U of R that she worked with to kind of help us build this out. And so, you know, the deep dive analysis of this continuum really laid out the framework to help decision makers like yourselves and those working to support those impacted by poverty to better understand how to make sense of the current needs and concerns of their intended beneficiaries. For many of the survey respondents, navigating their lives in this continuum had been their reality prior to the pandemic. And this is a point that I want to continue to emphasize. A lot of the questions that we asked and the answers that we received, had we asked these same questions 6 months ago, a year ago, 2 years ago, for the specific population that we engaged, you're going to see a lot of similarities in the ways in which people responded. And so what the pandemic has really done is added this consistent cloud of uncertainty where people are constantly questioning what is going to happen next, right? The cloud of uncertainty impacts everyone regardless of where you may fall on the spectrum itself. So the main takeaway in our analysis is that the more not fine an individual or household is, the less resilience they're able to exhibit. The more fine they are, the more ability they have to be resilient. And a lot of what we heard was that it was mainly due to the supports that they already have around them, such as their social capital or other resources, right? So for example, a lot of people mentioned how they didn't necessarily need childcare supports, but when you dove deeper into the findings, you realize it's because their kids were at home and they had older children at home, so they didn't need to pay anybody to watch their kids anymore, right? So again, those social supports and resources that they have available to them. The cloud of uncertainty that we talk about really reflects the major barriers respondents identified as a result of the uncertainty caused by the pandemic. So speaking both to the public health crisis as well as the pending economic crisis. And I always want to remind us that when we administered this survey, it was during a point in time where we were all kind of still holding our breaths and just assuming that within a week or a month, everything's going to go back to normal. And so that's kind of, you can see as you go through the report, a lot of people still have that kind of mentality. But as we all know, there is no end in sight, and we're all just trying to figure out what this new normal looks like and how we're all kind of managing and figuring out what life looks like now. So again, this continuum really helps us to understand the needs of our intended beneficiaries better because it allows us to recognize that this is a new normal. And it's not just those who are impacted by poverty who can fall on this spectrum. But this added cloud of uncertainty has made the experience of living in poverty doubly difficult to navigate, right? So I always make it a point to say even individuals who may not be considered to be impacted by poverty can still find themselves on this continuum because at the end of the day, every single day that people are waking up and new problems are arising, it's impacting how they may fall on this continuum, right? So if I wake up tomorrow and I have food in my fridge, but all of a sudden I have this huge RG&E bill that I wasn't expecting, that pushes me further to the left on this continuum because that's a little bit more that I have to figure out how to navigate my way through. So as we dive deeper into these report findings, really the question that I want you all to kind of keep in mind is, how can we ensure that the decisions that we are making moving forward not only meet people where they are on this continuum, but also impact them more positively to move further to the right on the spectrum, to even be able to think about what self-sufficiency might look like for themselves and their households.
So we did share this out with community members who had responded to the survey, and one of the pieces of feedback that we received was that the continuum can be a little confusing to look at the first time, and folks naturally wanted to place themselves in one place. And they were saying, well, I know my income is this low, but I kind of feel like I'm fine. And so I wanted to make it really clear that this is, as Lorianne was saying, a continuum, and people move up and down it in different ways at all the time and at the same time. So as an example, let's say you were talking to a single mom with 2 children who's a CNA and makes about $13 an hour. Maybe she receives some food stamps, but maybe she doesn't receive the full amount. So maybe before the coronavirus pandemic hit, she was okay. She was making it work. But then let's say the pandemic hits and the kids are taken out of school and they're at home, and now this mom is trying to manage childcare. She's trying to manage the kids eating tons of food. This came up 100 times, that the kids were, they had 2 different stomachs. They're at school stomach and they're at home stomach. And they're at home stomach, they were eating and snacking all day long. And for a lot of low-income families, that was really breaking the budget. On top of, we know there was a lot of price gouging and a shortage of essential coronavirus supplies like masks and hand sanitizer. And these things really were pushing the budget for folks who were already basically at their limit before the pandemic. But then let's say that this mom's brother steps up. She has a really good family. She's able to get them to help her out with some of the childcare needs. That takes care of the food meals during the day. And now maybe it's been a few weeks, there's some more resources popping up, including some maybe virtual counseling. So maybe the family's actually learning a lot of really good coping skills. So that's pushing the family to the right, which is what we really want to do, is pushing people right closer to future fine on our self-sufficiency continuum. But then let's say news breaks out at her job that there's going to be some budget cuts and she might be losing her job, but she really doesn't know. And so this is amplifying that already existing uncertainty and job stability. So that would throw her right back to the left on the not fine side of our self-sufficiency continuum. But one thing that came up many, many times was this idea of long-term goals and resiliency. So maybe despite all of this, she is so focused on, I'm going back to school, I'm going to get my nursing degree, and that's really going to carry me forward. And so actually, despite all of this uncertainty, there's a part of her and her family that's really future fine oriented. And so that was a way I wanted to show really the movement of this self-sufficiency continuum. And Lorianne, I don't know if you have anything to add.
Yeah, no, this is really helpful as we've kind of gone around and talked to people about it, because I think it's really important to understand that this idea of meeting people where they're at is really, really crucial and important, because that really does inform the ways in which we can kind of step in and support that individual, that household. Because if you don't have clarity on what they're dealing with, where they're at, what their main issues are, the solutions and supports that may be provided for them, although they may be good, may not be what that household may need at that time. So it's just really important to understand that we know where they're at during whatever point of crisis.
So we also wanted to show you guys so we consulted with Dr. Joyce Beckles at the University of Rochester to do the qualitative analysis, to start the qualitative analysis of this report. So she used constructed grounded theory to really look at all of the open-ended questions. So we had, remember, 550 survey respondents. That ended up being something like 2,000 responses to all of our open-ended questions. So she and her team really went through and pulled out 12 thematic codes, which we then used for the rest of the report. We have about 12 of these codes, including themes of talking about wanting normalcy and stability, access and availability or lack thereof of basic needs, the ability to meet basic needs, and the stress of navigating finances, this theme of physical health, obviously given the pandemic, this theme of mental health, obviously given the isolation of the lockdown of the period. We also have themes of safety and comfort, themes of moving forward, the recognition of vulnerabilities such as being older or sickly or an essential worker, these kinds of vulnerabilities that put people more at risk of the pandemic, systemic barriers and supports, family and community connections, and then this other. So that's a lot of data and a lot of ways to slice and splice the data. We are only going to do a very handful of them, and you can look at a more comprehensive review of those in the full report in the link that was shared out in the chat.
I wanted to just do a quick check-in real quick. Again, I do recognize that this is a lot of information that we're throwing your way. And I guess I just wanted to give a quick second to see, give you all a chance to react or ask any questions that you may have before we move forward to this next section.
There is a question in the chat about coordination with city and county departments that might have been leading some aspect of the COVID response. How have they been? How will they be connected to this survey?
Yeah, so as part of the outreach efforts, we definitely did work a lot with both the county and the city to ensure that we were able to distribute the survey out to folks. And so there was some partnership on that level. I think moving forward, definitely we're looking for ways to try to reduce the duplicative efforts around the surveying that's going on, and try to figure out how we can probably work a little bit more tightly moving forward.
And I'd also add to that, so at the time that we were doing the survey in May and June, we had some real-time dashboards up on our website where people could go to see the responses that were coming in. They obviously weren't analyzed, but at least the numbers. And we were providing updates regularly to the crisis response task force, whatever that group was called, that was meeting at first daily, then a couple of times a week, then weekly. So we were regularly providing updates to that group at the time that the survey was happening.
And Maya, to your question, I don't have a concrete number of the exact number of people who the survey was sent out to, but we do have a comprehensive list of all the different groups that we engage with to get this information out, including the various nonprofit organizations that we know already directly engage with the population that we were hoping to have participate in this, as well as various grassroots groups. We use community influencers to kind of share the information out online, as well as broadcasted the information about the survey using 105.5 The Beat and various social media tactics to try to get this out as much as possible. Okay, so we'll go ahead and keep going, but feel free to continue to ask questions in the chat as we move forward.
So given that we are the Rochester Monroe Anti-Poverty Initiative, we've decided for this presentation to really focus on the basic needs and the income side of things. So on the income side of things, one of the big pieces that came out of the qualitative data was the stress of navigating finances. And they really spoke about navigating finances in terms of how to pay for basic needs and how to maintain or get employment. So when people talked about navigating finances, we sliced and spliced it as many ways as we could, and saw that folks who had indicated they were not working, so maybe they were a student, maybe they were disabled, maybe they were unemployed because of or before the pandemic, as well as folks who are essential workers, who had self-identified as essential workers, they seem to be pushed left on our continuum. So they seem to be talking more urgently about the navigating the finances and paying their bills. There seemed to be more strain on those groups of people. Across all income levels, when folks indicated that they had a child in the household, that seemed to also lead to a lot more uncertainty in terms of navigating finances. People really were speaking to, I'm okay if I keep my job, or I'm not sure what I'm gonna do if this goes on too long because I need to get back to work. So having children in the household seemed to really speak to, like, I have people I need to feed, so it's really important to me to have financial stability. And then, of course, this is not surprising, but when folks indicated that they had lower incomes, which we looked at in terms of having less than $25,000, they also seem to speak more urgently about their navigating finances in terms of basic needs. For essential workers, this came out, even though they tended to have more job stability, this really came out in terms of, I'm not making enough money to justify the risk I am putting on myself and my family during this coronavirus pandemic. On the flip side, though, of moving people to the right of the continuum, people who were remote workers seemed to be a lot more future fine oriented. They were talking a lot more about just job stability rather than I need to desperately get a job right now. Folks also talked a lot about the stimulus payments and unemployment benefits, not a lot about unemployment, mostly the stimulus payments folks talked about, in terms of helping stabilize their finances. And then people talked about whether they had it or not. They said things that would help them navigate their finances was a stable and well-paying job. I really like this quote that came out of one of the individuals who had talked about navigating finances. We asked them, what would you need to recover financially? The answer, extended grace periods for payments. I've shuffled things around to get by, but when this is over, the companies will expect payment. It would be nice to have a grace period. One of the structured questions that was asked was, how have you or will you use your stimulus payments? And I really felt like this was an important theme to pull into this presentation. Across all respondents, not filtered in any way, we saw the top 3 things people said they used their stimulus payments for was savings, meals, and bills. When we then spliced it with our RMAPI lens of somebody making under $25,000 with children in the home and working an essential position, that really didn't change very much. They also wanted to save, to pay for meals, and to catch up on their bills. And I think this does a really good job of showing that there's a lot of myths out there about lower income households and how they're able to manage money. And I think this really highlights like the myth busting of, you know, we're all just kind of trying to survive the situation. Okay. And I'm trying to keep an eye on the chat, but feel free to stop me if there's any questions. We really want to emphasize throughout this, not just the data and what we saw in it, but we want to emphasize what survey respondents, so community members themselves, said that they need to help push them to the right on this continuum. So themes that we were able to pull out from all of these open-ended questions: people asked for pay raises, essential workers asked for hazard pay, lower income workers asked for just pay raises. Really everyone asked for pay raises, to be honest, no matter where they indicated that their income was. People also asked for more government relief. So the stimulus payments seemed to be a huge relief, and people asked a lot for a second one, or they asked how they could make sure that they were eligible for the first one. People also talked a bit about unemployment and wishing that the unemployment was more rapid. People talked about wanting to find employment, especially if they had lost their jobs, had not yet received their unemployment benefits. There were folks who said, I don't care if it makes me ineligible for unemployment, I need a paycheck today. Folks who are already unemployed really wanted to also find ways to get employment for those essential positions still hiring. People wanted sustainable employment that had living wages, tracks to promotions, and meaningful careers. And people also talked about this theme of financial empowerment, so building savings and access to credit. And there were a handful of small business owners that also responded to the survey, and they spoke about wanting financial relief for small business revenue loss that was occurring at the time. Okay. And I will pass the puck over to Lorianne.
Yeah, thank you. So one of the other things that we wanted to focus on today was around this theme of meeting basic needs. And so as you can probably see on here, a lot of people who were either already not working or were not working as a result of the pandemic, losing their jobs as a result of COVID-19, were really struggling to meet their basic needs. Across the board, just having children in the household, period, added a stress and a strain for those households to meet those basic needs. And obviously having low income or middle income made it that much harder for people to meet those basic needs. So really people talked urgently about their, the need of paying for food and essential COVID-19 items, as well as balancing household bills like utilities and rent. A lot of people had things added onto their budget that they did not plan or foresee as a result of this pandemic. Again, we talked about it earlier, something as simple as trying to keep your kids fed for breakfast, lunch, dinner, snack time, before bedtime. That's a lot for a lot of households, especially those who were impacted by poverty. A lot of folks talked about, normally they only had to think about feeding their kids for dinner and maybe dessert, never really having to think about feeding their kids Monday through Sunday for breakfast, lunch, and dinner. And it really takes a huge chunk out of people's budgets. And you could really sense that as people were sharing out during these codes. And I think that the main takeaway that I wanted to lift up for this specific theme around meeting basic needs, Angela, if you want to go to the next slide, is really just this reality that availability does not equal accessibility. A lot of the things that people said they were struggling with are all resources and and supports that I know for a fact are being provided because I'm a part of the RMAPI collective and various other tables, but we're constantly hearing people say that they're struggling being able to access these actual resources, right? And so I think a huge takeaway really is, yes, we have these resources available to people, but people are not accessing them, right? And so we really probably should start thinking more about adding intentionality around not just providing the resources, but how do we make sure they actually get to people, and what does that look like for folks? Because as you go through this report, you're going to see a lot of like needs that are being lifted up. But if you check them against a list of needs that we are all kind of responsible for providing, it doesn't add up, right? And again, just keeping in mind, availability does not equal accessibility. And we really need to start thinking more about how to mitigate this reality. Again, we asked people, have you experienced any difficulties getting basic needs due to COVID? As you can see, food was the highest on this list. And next to that, people talked about housing needs, so rent payments, etc. People talked about transportation needs. A lot of folks talked about transportation in relation to wanting support to maintain their personal vehicles, trying to keep their cars on the road. And then also a lot of people talked about wanting to have more like ride share incentives or credits to help them get around so that they don't necessarily have to be on the bus, considering everything that we have going on. So those are some key things that came out of that question. Another theme that we wanted to talk to you all about was, this code around systemic barriers, things that people kind of lifted up as things that were making it really hard for them to navigate their way through. A lot of people talked about eligibility requirements for assistance and SNAP benefits. And really kind of talking about how it really sucked that they really needed this right now, but they did not meet these requirements because on paper, they look like they have it all together, but in reality, they're barely making it through. Again, we all know that people had their kids at home, and trying to figure out how to really support their kids academically was a real struggle for people. People were trying to figure out what resources could be available for them. Again, financial burdens caused by employment instability and delayed unemployment benefits. There are a lot of things that were out of people's control that were impacting them and pushing them further left on this continuum. And there was not much they can do about it. One of the quotes that came out of this was, income or resources to stock up so I didn't have to leave the house. I am one of the people who has a child to support that is out of school but over 17. So I didn't get the extra stimulus or the increased SNAP benefits because I'm already at poverty level, which means I always get max SNAP from my household. So none of the extra resources were available for us. So a lot of people are really talking about wishing they could access all these benefits available, but just not being able to make the cut. Okay, so some of the suggestions that a lot of the survey respondents provided in relation to supporting household expenses and meeting those needs. People talked a lot about wanting to see grace periods and flexibility. So we all know that at the height of all this, all these organizations and resources were saying, hey, you don't have to pay us right now. You could pay us when this is all over. But a lot of people were thinking about, okay, when this is all over, am I even going to be in a place to be able to make these payments? And because I may not be able to, am I going to be negatively impacted as a result, right? Is there going to be room for grace periods and payment plans and just flexibility, period? Again, they talked about wanting to see more expanded benefits, wanting to see more people being eligible for some of these resources that are available. Food support came up a lot still. Subsidies for COVID supplies. A lot of people were saying how they really just couldn't afford to keep up with the COVID necessities at the time to keep themselves and their households safe and healthy. Telehealth and medical delivery and at-home healthcare services. A lot of folks talked about wanting more mental health support. As you read through this report, you're going to see a theme of people just saying, I feel like I'm going to lose it, especially a lot of households with children in them. We had some conversations with some moms, and one woman literally said, I may have a mental breakdown if my kids can't go back to school. I literally cannot take having my kids at home. Financially, mentally, it's exhausting. I can't really maintain it. I have no support. And you could sense a lot of shame in people talking like that because they would always tell you something, I don't love my kids. I just don't have the support to be able to maintain and be there for them the way that they need me to. And that's really a key theme that we see a lot of. Again, transportation supports, education supports. People talked about subsidized technology supports because we knew we were going to be staying remote for a little bit longer, and a lot of households didn't have the means to be able to really support the technology needs. But we are all already kind of having this conversation about the digital divide and trying to figure out how to better support households that way. And as always, people talk about debt relief and credit repair. Again, thinking about things that can help them move further to the right on this year continuum. And then we can go to the next one. And so although throughout this report and throughout the survey respondents, you know, a lot of people talked about the things that they were worried about, the things that they needed, but there was also a huge theme around people just talking about what's going to happen next, what they would like to see happening, what moving forward looks like, and a lot of talk around like missing community. It's like one of those things where you don't know what you have till it's gone. A lot of people talked about wanting to see more opportunities to just be in community with other people, virtual and safe spaces for community events, support groups, education programs for their kids, and just activities that kind of help rebuilding the community and that feeling of not just being alone in your house all the time. One of the quotes that came out of this was just, you know, hoping that some organizations do not close down so the community as mothers, as dads, as elderly and homeless people all can come together and have organizations that help us all, hoping and praying that it brings us all closer together. So people just trying to think ahead and figure out what's going to happen next and what that's going to look like for them. And so again, we understand that this is a lot of information and we're really hoping and encouraging you all to take time to go through the report in Data Studio and just dive through at your own pace. But what I wanted to leave you all with really was that our goal, many of you are familiar with our community engagement strategy. And in there, we introduced a spectrum of engagement framework. And so the benefit of this spectrum is it recognizes that there are different levels of engagement, and it speaks to the degree in which people get to be a part of the choices being made. So the spectrum manages expectations and it creates opportunities to build and maintain trust and relationships with intended beneficiaries. And there's no right or wrong place to be on this spectrum. It all depends on the purpose of engagement. So with this survey that we conducted, our goal and our purpose really was to be proactive and create a way to adequately involve those we are trying to support, our community members impacted by poverty, and helping us co-define our full understanding of the problem we are facing. And so on the spectrum, really with this report, with this survey, with the engagement that we kind of went through, our goal really was to involve people. This is where we're at on the spectrum. So with that being said, we really want to kind of explore with you all what it looks like for our RMAPI to ensure that the concerns and needs identified by community members throughout this report and throughout Data Studio are directly reflected in whatever decisions we choose to make as we move forward. So with that, I wanted to kind of open it up to discussions and have us think about some questions that we can kind of talk about today, start capturing some notes and figure out what these next steps might look like as we try to figure out how to actively do the work of prioritizing community voice. So one of the first questions that I wanted to ask you all was, again, I know this is a quick snapshot, but have any of your assumptions been affirmed or debunked as a result of some of the information that you heard today in relation to how people have been impacted by COVID-19? And could you share any of those examples? Feel free to just unmute yourself or, you know, write in the chat as well too, but I'm just curious to know and to hear if you all assumed this was what you were going to hear, or if there was anything shocking in here that you did not see coming.